I am live. Welcome to the Chat Here Show. Just tuning in. If you're joining us, okay. Making sure everything gets set up. I think this tablet decided to start doing its decided to start doing its updates right in the middle of me starting. But nevertheless, let's start the show. Welcome to everyone. Welcome to those of you who are tuning in on TikTok right here. Welcome to those who are tuning in live on Facebook, Instagram, and YouTube. Welcome to the Chad Beer Show. Glad you could make it. Hi, Jack. I see you there on TikTok. The thing is this with the TikTok now, for those of you who are on TikTok, you aren't able to see all our guests who are on the, Facebook and YouTube due to my technical difficulty in trying to get this stream from one camera right into the many different platforms. So that's the issue I'm having right now. So for TikTok, you're seeing just me. For those of you who are on Facebook, YouTube, and Instagram, you are getting the guests and everyone who's coming in. But thank you nevertheless for joining in. And welcome to the Chad Pierre Show again. And we are continuing it with health and wellness. Let's see if we can get this to shut up. Yes. We're continuing with health and wellness, and we have special guests on the show tonight. We have coming back to us, Pam from the Nantucket Cottage Hospital. She's a registered nurse with over 20 years of experience. And we have Minister Yolandi Bailey out of Florida, who is a health record specialist and also CNA. And we're going to have a live conversation this evening. For those of you who want to join in, if you have questions, I think you can pop them on Facebook, let me see, or comments, and we will get them going for you. So if you have questions, just put them in, I think, and we will try to see if we can answer some of the questions. We use this platform as a means of education, sometimes entertainment, but more so to have a meaningful conversation with our local folks in and around the area and with others who want to join in and have a chat and let each other know what's going on, depending on the topic we're having. Our conversation also is based on, facts and we're not here to have wars and fighting and all that. We're here to have a conversation, discussion, and also to have debates, healthy debates on whatever topic we're talking about. Week before last, our topic was the same on health and wellness. And we went from having what we wanted to push across out there is people who are afraid of getting health screening. And there's a huge difference among men and women as it results in getting health screening. And then we narrow it down, men in general, then we narrow it down to Black men, and then we narrow it further to men in Jamaica, as most men in general do not like to go to the doctors, and we keep asking the question, why? And we find out that a lot of times, many of these people will find out that they have some, stage 4 cancer or some kind of deadly disease when it's too late, because they could have had some care prior if they had found out earlier, because they are afraid of going to the doctor. I wouldn't say afraid, but they are just reluctant in getting checkup. And this is most in men in general. I have spoken to some women also who say the same thing, so that they are really afraid of, or they don't like going to the doctor. And I think because sometimes they feel like might hear something that they don't want to hear. And I think in general, the majority of us don't like going to doctors and hearing that something is wrong. But then on the other side, we don't like feeling that something is wrong and then end up having to go to the emergency room and find out the worst, or going to personal doctors and hearing that it is worse than what we were expecting. So we create this health and wellness conversation so that men and women who are in and around us, go to the doctor, get your regular checkup, get your screening, get your, your yearly exam and checks to make sure that things are in order. Make sure you get things in order, because you don't want to find out that something is terribly wrong with you at the end of the day and you're going to stage 4 or 5 cancer, and then you're given weeks and days to live. We do not want that. We encourage you to get your regular checkups early so that you can, if there is a problem, you will find out. And the statistic tells us about people with cancer. And so we're going to discuss tonight. We have some segments here, some topics, and we're going to tap in to the different people to give their views on how and when we should seek medical attention. I think the majority of people will jump to their phone and call 911 if somebody falls over, or if somebody's having a heart attack, or if somebody, depending on how one feels, they will quickly call 911. And that's the best thing to do. And we're not going to tell you not to do that. We're going to tell you to call 911 because there we go. We definitely need you to call 911 in the case of an emergency. So we have some people that are experienced. We have Pam. She is from the Nantucket Cottage Hospital. She has a wealth of experience as it relates to emergency room, you name it. She is the boss. We had her on the last segment, and it was absolutely a blessing to have her because she knows what she's talking about. And we had we were unable to have Jessica join us, but she will join us at another time. And as I said, we have Minister Yolandi from Florida, who's a health record specialist and CNA, and she knows her way around the medical field. So we're going to dive right in, and we have some, I have some questions myself that, I will need professionals in the field to answer. So ladies and gentlemen, let us welcome Pam to the program. There she is, up and about. Welcome, Pam. Good to have you. And also Yolandi, good evening and welcome to the Chad Pierce Show. Yolandi is not a stranger, neither is Pam a stranger, because she was very instrumental in the at the time when we had the hurricane in Jamaica, Melissa. She did a great job in getting the program, and we'll get into that later on. But these are people who are no stranger to me and no stranger to the Chad Pierce Show. And we want to say good evening and welcome. We'll start off with Yolandi. Why don't you tell us about yourself?
Good evening, Chad. Good evening, Pam, and good evening to the viewers. Like you said earlier, I am a minister of the gospel. I'm also in the health records specialist field. I've been doing health records for a little over 14 years. I'm also a trained CNA, but a lot of my experience first started out firsthand before I actually went into doing health records. I'm a mom, and I spend most of my time doing ministry.
There you go. And Pam, we want you to introduce yourself. No, we have you on on camera this week, which is so nice. Go ahead and introduce yourself.
Well, good evening, everyone. Hello, Yolanda. And I'm looking forward to being with you tonight. And Chad, thank you again for having me on. And just a quick introduction, not much I have to say for myself, except as you said before, I'm a nurse. I'm a registered nurse at Nantucket Cottage Hospital. I've been a nurse for over 20 years. And Also, I said that most of what I do, or all that I do, is grounded a lot in my faith. So I practice my faith. I practice how I live my life as a Christian. So that comes first and foremost. And as we talk tonight, I guess you'll get to know a little bit more about me as I respond to some of the inquiries as we have this discussion. So thank you again for having me. Good night, everyone. And I look forward to us talking again.
All right, thank you. So we invite those of you who have any questions. We have a WhatsApp for those who love WhatsApp, and especially in Jamaica. If you have any inquiries, you can call us or text us. It's 876-434-4279. That's 434-4279. And also, I am going to pop over on Facebook to see what questions are there, because the last time there were some folks asking question over there, because it's kind of a one-band show. I was unable to, look over there. I have somebody who monitors the TikTok page to answer any questions that people may have, because I've seen a lot of folks and they find it very interesting and informative on the information that we put out, because we have professionals in the field. It's like, sometimes you want to ask a question, but you're shy. So nobody wants to come up on camera and ask the question. But what they will do, they will come up, if somebody else asks the question, then they like when somebody else asks the questions and they get the answers that they're looking for. So we're looking forward in having each and every one. If you have questions, just send a question and we will do our best in this. There are a lot of areas and avenues as it results to medical. You have to think about, especially in the hospitals or in the nursing homes, medical facilities, you have HIPAA laws and stuff that prevent certain kind of information from going out, certain kinds of document sharing, certain kinds of information sharing, even among other departments within the same facility. We understand that. So we want to make sure that, you cannot just call up a hospital and say, well, I heard my friend Joe is admitted and I want to know what's the cause and what he's suffering from and so on. And, Joe is my best friend and we've been best friends for 20 years. I want that information. Those things don't work. If Joe decides to tell you what is going on with him, then it's his prerogative. But in the medical field, it doesn't happen that way. And Yolanda can probably speak towards, some of those record keeping. Like, those things are confidential and they are privacy. And so that's why they have laws to prevent us. What we speak on here is general things that benefits everyone, whether you're admitted, whether you just go in for a regular checkup, or, nothing we speak on here is in privacy. But a lot of things that we speak here as it relates to health might affect one or two people within a community. I myself is going through a situation that, if all my friends know about, which affects me, it affects my family members and some of my friends. It's an open thing that is going on. So that information, that's public knowledge. And, in the overall umbrella, and I never want to get rid of that while I'm on this show, that part of me and talking to people, my faith is going to be part of this discussion, because I don't believe in anything moving forward without talking about my faith and prayers and all that. So just so you know, and that you're aware, that when I'm going to talk about health, as much as we want to talk about science and medicine, I still believe in divinity. All right, just to get that record straight. So moving to the first segment here, preventative care and screenings. What routine screening tests or vaccines do I need for my age? And Auntie Pam, if you could expound on that for us.
So is that a question for someone they're asking? Because
No, this
depending
is
on
what
the age.
I had on paper.
Okay. So, of course, medical screening, we talked a little bit about that on our last call, that, for adults, they should have an annual screening and frequent follow-up and checkups, depending, again, on age, health history, comorbidities. So that range varies a little bit, but at least annually. So vaccines, of course, that's a kind of one of those controversial topics, but at least the very basics should be chickenpox was eradicated a while ago because people got the chickenpox vaccine. So measles, mumps, and rubella, we say that children and adults should have those vaccines, and those are your common ones. We think about there's a myriad of vaccines that persons could have. You can hit or miss some of them. Some you can choose to have or not to have. But anything that would cause widespread pandemic that spreads from one person to the next is really common to have. Those are typically listed in your physician's office. So you get to like I said, for high school, to get into school, there are specific vaccines that children has to get. Now, adults, when they get to adult age, if you haven't gotten some of them, you're over that age, then that you can pick. So there's tetanus, there's pneumococcal, there's a shingles vaccine, depending on your age group. Again, you're getting into 40s and 50s. We're looking at shingles vaccine, the Shigrex. So there's multiple vaccines, but what I usually say to patients and to, just generally, when you get into your doctor's office, you should be having the vaccination conversation. There's flu vaccine, and we all know about the COVID vaccine. And those things, there is a choice for all of those things. So there's a list of them. And when you go in, that is a question, that is a valid question of what vaccine should I be getting? I could tell you and I could say you should have this one, but depending on how you feel about vaccines and how what your exposure is, then that's sometimes how I think persons decide on there. So the long and short of it is that the list of vaccines is very long. There are mandatory ones for school. For me, for healthcare, there are mandatory vaccines for healthcare, and then in general life, there is a bunch that you can pick and choose and refuse as you age and get older.
Okay, Yolandi.
Thank you, Chad. One of the most common screenings that are done for people our age, I believe, is screening for cancer. If there's a history in someone's bloodline, like peradventure diabetes, glaucoma, other diseases that are considered hereditary, then you will find that the screening period for those persons start a little bit earlier than other persons, depending on the traits that are consistent in persons who are of close relation to that person. A lot of people in Jamaica are aware of sickle cell disease. One of those things, after a child is born, that's the first thing they test for as well, whether the child is carrying a trait or if they're carrying the full-blown disease. So there are a number of things that we should be looking into once you hit 40. If peradventure they are predominantly in your bloodline, especially among women and men, prostate cancer, breast cancer, ovarian cancer, uterine cancer, then you want to ensure that you have that discussion with your practitioner even before you get to age 45. And I know that a lot of men are very shy or very adamant when it comes on to getting their prostate screening. My grandfather actually passed away from prostate cancer, and I believe there was no early detection, so it was very difficult for them to preserve life, after they found that he was already at stage 3. And I think the reason for that is because of the examination process. A lot of men believe that this is invasive when it comes on to their privacy, the body part that a doctor has to examine. But I would say to that person, take, for instance, you have a toothache, you have to go to the dentist. The dentist has to look inside your mouth, diagnose the problem, and get you some assistance. So think about it from that perspective. It's not a toothache, but it is a medical condition. It's something that you would like to know the diagnosis for. You do not want to live with this condition until it is too late. And then you say, if I had known. Yeah.
Yeah, sounds good. I mean, we talked about that the other day because, men, I don't know, and just some, because I know of other men who, if there's a mosquito that flies past their face there in the ER. So, and which is good because it's better to prevent than, prevention is the best cure. I also looked at the statistic that says about 68.7% of Jamaican men, it has reported since 2011, has not seen a doctor, which is, and I, now that we mentioned it, and we're talking about this statistic, uh, if men are not thinking about that, how will you think about having your family to watch over your family for a prolonged time, length of time? If you are afraid to go see the doctor, that means that you might have cancer and you might die and leave your kids and your wife. You know what I mean? So I don't get how you would not want, because just as though you go out to work to make sure that your family is fed and that they live a good life, the kids go to school, they get clothing, all that. Why wouldn't you want to take care of your health to, carry on so that when your child gets to 5 years old, they don't lose their dad or their mom because you do not want to go and get health screening for something that you might catch earlier before it turns out into something that you really don't want. So there's, as you mentioned about, it says family history. How does family medical history affect the personal health risk? And Yolanda talked about it a while ago, Pam, the same, in terms of, these things that are hereditary in the family and, heart disease and diabetes and all that. So because we had spoken about that, but let me ask, for somebody who really, I don't want to use the word afraid, but is it that they're afraid? What is it that disconnect that makes them not wanting to have a conversation with their doctor about certain thing? And if you could give me, if you could give an advice generally to say, can you try this way to see if that will make you feel a little bit more comfortable in expressing, this to your doctor?
So, I just have to caution so I don't, not repeating much of what we did the
Mm-hmm.
last session, because we talked a lot
Yeah,
about
yeah.
all of this and all of those diseases that Yolanda had brought up in terms of screening and all of those. So, how we had said the last time, and I still think that that is important when we, especially for men, when we frame the conversation as them being the anchor for their homes and the anchor for their families, and to highlight the importance of it, that what you just said, and we kind of did that over and last time we spoke about this, is that we have to have men see their role in the family, that if that element is missing, if they're not a part of that picture, then a lot of things fall apart. And that still has to be the message when we get to them. Or the other thing that we talked about is there's an example in the community when
Mm-hmm.
someone champions the cause. So if there is a male who says, you know, I'm not afraid to say I had my prostate checked. Like I said, we're from a homophobic nation. And so a lot of it, like Yolanda kind of touched on it a little bit. And again, I said, I don't want to
Yeah.
overemphasize the point because we talked about it a lot on the last call, is there has to be an example of this becomes almost, it's trending in society. It's trending in our communities. Men are getting their prostate checked because if they're not in in the picture, the families suffer. So when we get to them and they get to the seriousness of what happens when they're missing out of the equation, I think somewhere it makes a conversation. We should start seeing them actually not even how to approach a conversation. They're the ones who are asking for this test. That when you get to them and the message is very clear, then we find that they're going to their primary care physicians to say, I want my prostate checked. Because even if you teach them how to have these conversations, I don't necessarily, because they're so strong, they're so stoic, whatever it is that drives men, how they operate just within their mind space, they sometimes, I don't think that even teaching them to have the conversation, it is understanding their role, their leadership role within their families, and if they're missing, the consequence of that. And so until they start getting that and we start driving that home more, then I think, like she said, they didn't know her grandfather. He was at stage 3 by the time they got him, and he passed. And there has to be a real gut check that it is real. Prostate cancer does kill, and if you're out of the equation, and people 50, that is kind of like the age where we're seeing a lot of men being diagnosed with prostate cancer.
Yolandi, anything to add to that, or is
You
well
know,
said?
I believe that culture does play a huge role in how the message is transmitted or relayed to our men. You see a disparity between Caucasian men or American men and Jamaican men or men from the Caribbean at large, because when the conversation comes up, the first thing, first thing first is that sex is a taboo subject in the Caribbean. And this
Mm-hmm.
is a conversation that many other nations culturally start with their children, not as adults. And because the conversation of sex and all the things that are related to sex are not an open subject, an open discussion, especially even in the church, we find that everything else or a lot of things associated with sex or the sexual organs are also a taboo subject. People are very secretive when it comes on to medical diagnoses, especially when it involves certain body parts, the breasts, the vagina, the prostate. These are conversations that persons are afraid or shy about having. I believe that many people in the Caribbean have also treated these conditions as if it's something that you actually went out and caught, like it's a transmittable disease. And because of that, there's this fear of having persons know that there's something going on. By the time a lot of persons actually start to share that they're undergoing treatment or having a crisis medically, it sometimes is too late, or persons learn about it after they've gone through all their treatment processes and have actually healed from some conditions. So I believe the one of the issues that we're having is or cultural or cultural background in having certain conversations become an open matter, become an open discussion amongst our peers, amongst our young people. In fact, last year we took on a project to create what we call a HER kit. HER is an acronym for Health Empowerment Relief Kit. And of course, all little young girls get their menses at some point, right? But the problem that we were having is that young women were not open about discussing the problems they were having with what some people would see as a normal menstrual cycle, as opposed to an abnormal menstrual cycle, like severe cramping with back pain, vomiting, diarrhea. Those are not necessarily normal things. And this is the time when you want to say to your mommy or your daddy or a teacher or a private practitioner that I don't think that my menstrual cycle is normal, because these are some of the things that are happening to me. So many young women do not know anything about PCOS or endometriosis. A lot of our Caribbean women don't know what these things are until they travel outside of the country and express some of these problems that they're having to another practitioner. So I think our culture has a really big role to play in how we have these discussions and how we treat these problems.
That is so nice. As you talk about that, when I look at the document that I have was going to be that's the next thing that was going to, but since you talk about it, good. We because it says here that red flag, early warning signs, symptoms, and what actively I should watch out for. And as you mentioned about that, and I think also as as Pam says, we're not gonna go back into this because we went through all of this the last time with, I think in our culture too, like, parents and kids don't have that open conversation where they talk about certain things and what to watch out for or look out for. And I think nowadays different from when I was younger, because it was worse back then. Now I think it's easing into a little bit more an easier or comfortable area where parents and their kids can have a conversation about certain things. Then you are watching TV, if you did have one, and two people were kissing and you just couldn't look at your mother sitting beside you watching the same thing. You know what I mean? So I think we've come a far way in terms of what we can discuss with our parents or sit down and watch with our parents or somebody who is older than us and all that. Um, let's get into the segment of home remedies and do they work. So, also growing up, I had the pleasure of having three of my great grandparents when I was growing up as a child. So, we get to learn a lot of stuff from my great grandmother. All right. And we are from a culture where we are sent outside to go pick this bush for that and do this and do that. All right. Do home remedies work? And should I read first before I have you expound on it or just have people listen to you from it? Go ahead.
Interestingly, from as we talk about medicine, home remedies, and the big pharmaceutical companies, as they do mass production for drugs, it came from the roots. It came from the ground. It came from somewhere before they started experimenting in labs, before they started creating. So yes, home remedies does work, but there is the side of caution that has to be employed with it. We can't just go out now in 2026 and pick any herb that we feel like and say, okay, this is what I have a UTI, so I'm going to go and take, I don't know what it is that they used for it back then, what would have been the home remedy for that. But I see that people are still into a lot of natural remedies. What would be interesting tonight for me to hear, I don't know if folks are on, like, what are some of the remedies that people are using out there? What are some of the things? I know growing up, we had something that you would hear about cerasee. Cerasee is bitters. So is bitters good for your blood? We're not saying no, because our grandparents, they grew up on it. It worked. However, we know that the extent that bitters are used for, it's like to purify the blood, but it thins the blood. So you have somebody who is on a blood thinner, like Coumadin, they're having bitters at home, and the doctor is giving them something else. So we have what we call an interaction of natural home remedies and what big farm is doing. It's how do we marry both of them so they work. So I'm not going to say that home remedies doesn't work. We know Leaf of Life, and it's still echinacea. We're still buying that over the counter, and it works. So chayote, as they call it in America, we call it chocho. Somebody would probably, their blood pressure is high, they say, I'm going to drink some chocho, and they will swear by it that it made their blood pressure come down. I cannot say that it doesn't work. We have had the testimonials of them working.
Yes,
So
we do.
tonight it would be interesting to hear what people are saying.
Yeah,
what
coconut water,
works for them.
jelly with a little lime juice in it to bring down the blood pressure. We hear that. So hear this. I have a few that, and this is, I got this from the internet, where medical experts generally divide home remedies into three distinct categories. Remedies backed by science, many common household staples contain active chemicals, compounds, and directly target illness symptoms. Experts from Cleveland Clinic point out that several home remedies, treatments, proven to be highly effective, like honey. So here's the first one. Honey coats the throat and suppresses nighttime cough. I think I need some right now. It acts as a natural antibacterial and reducing swelling in inflamed tissue. There goes honey. For those of you who are watching on TikTok, I know you cannot see our guests. Sorry about that. We cannot tie both cameras in for some reason, but we have Pam on from the Nantucket Cottage Hospital. She's been a nurse for over 20 years, and she knows inside out, from emergency room, you name it, right up to medicine. So if you're joining us, thank you for joining us. We have Yolandi, who also have over 14 years of experience in health records keeping, and she's a CNA, and she is a minister also. Pam also is a minister. So we have a household of many different backgrounds and beliefs here that work. So thank you for joining us. Facebook, TikTok and Instagram. You can see them, so you won't have any issues with that. So we're talking about health and wellness. And if you're just joining us, thank you for joining us. And we'll keep going. So we talk about honey. The next one, it says honey. Okay. Oh, we weren't finished. Oh, ginger. Ginger. They talk about ginger and the ginger rolls, which are heavily studied and proven safe to reduce nausea and motion sickness, pregnancy, or medical treatment. We have chicken foot, not chicken foot, chicken soup. Chicken
Chicken
soup is
foot too.
just comfort. Chicken soup provides vital hydration, and nutrients also contain anti-inflammatory properties that help clear nasal. And as I said, this is a study from the Cleveland Clinic. So these are, turmeric contains curcumin, a potent compound validated by research for managing pain and systemic inflammation. Remedies are ineffective or harmful just because a remedy is traditionally labeled natural does not mean that it is safe. So, as you were saying, but let me ask, because sometimes we say this, because when you go to the emergency room, the first thing they're going to ask you if you're on medication and what are the medication you're taking. But what if you drink some of these bush and then so you have a headache and I'm going to go out and pick whatever this leaf is and boil it for my headache. And then I'm going to go to the doctor and they're going to give me something for the headache. Is that overdosing, or how would you look at that?
I don't want to monopolize the platform. So, Yolandi, if you want to answer, you can go ahead. I do have the
It's open
response,
to
and
both of you.
you can
Take your
go
time.
ahead.
Take your time.
She can go ahead and I'll respond later on. That's fine.
So it's not necessarily overdosing, but there is, as I mentioned before, drug interaction. That is very, very, very important. And you listed some things there: ginger, honey, turmeric. We know that those things, they are effective, they work to some extent. But I talked earlier on, I just mentioned like a disease process, like let's say someone has a UTI. And I think you mentioned maybe garlic is an antibacterial and it's good for inflammation. If we look at the science behind, say, a UTI, a urinary tract infection, there could be a specific bacteria that needs to be treated with antibiotics. So I wouldn't say that somebody should go out there and say, okay, because I can put garlic down there, or because people do these things, by the way. They feel like they could put it down there and it's going to take care. It doesn't, the research doesn't show that that is effective treatment, even if it does reduce the symptoms and reduce the discomfort. It is probably still not completely treated until something like an antibiotic that has been, even though it's manufactured in the pharmaceutical industry, that is indicated to treat that particular bacteria, so probably doesn't come back. So of course the question should be asked, because we see it all the times in the ED. People come and say, oh, and I'm using a UTI because that's usually so common. Persons come in and say, we've been drinking cranberry juice because I'm trying to flush out the bacteria and all of that. That's not necessarily, or they're eating whatever it is, whatever natural remedies that they're saying that. So even if they're taking those things, it doesn't necessarily mean that there's an overdose, but there are some things that I will say with much clarity, with much confidence, that there are some home remedies that persons could be taking that could actually interact in a negative way. Let's say I'll use one of the quick examples. Again, somebody who is on, say, a daily aspirin, come in because they have chest pain, and you give them aspirin and they go home on a baby aspirin. They should be taking that every day. Take a baby aspirin every day. They're taking that, and then they're like, okay, well, I'm going to, because aspirin has a risk of bleeding, but it has a cardiac protection around the heart. Yes. And somebody says, all right, I'm going to take my aspirin every day, but in addition, I'm going to take something like grapefruit or kale or something that also is what we call a bleeder. It is something that it has a higher risk to cause
Mhm.
bleeding. So if you're on those two things, you are there. There is a greater risk for bleeding, which can have a negative impact and negative outcome. So of course, doctors will say, "What are you taking at home?" And they should speak up. Am I taking this thing? Because then folks will know, or the physician or your primary care will know how to prescribe, because there are interactions with some of those same things. The
Mhm.
meds that we're taking are made, like I said, from those same ingredients that were natural. They're just compounded from mass production in the pharmacy.
Yolandi?
There was a time when we did not worry about certain conditions, even in our grandparents, great grandparents, and a lot of this changed in how we eat. Yes. And if I could, permit me please to make reference to the book of Genesis 1:29 to 30. I have given every green herb for meat. Now, this is something that God said to to mankind, that the tree or the tree that yields fruit because a seed comes from it and yields other fruit, he has given unto us for meat to eat. And of course, we do have successes in the use of home remedies or herbs, because those herbs or plants, as Pam alluded to before, are actually used to create some of these medications that people are taking long term. However, we have found that over the last 30, maybe 35 years, that some of the very same medications that are used to treat a single condition actually result in multiple other organs being affected by such medications. And you see people having some medication induced illnesses. I remember, particularly, I have a family member who got medication induced diabetes. She never had diabetes, eats very well, but after having a surgical procedure done, the medication that she was taking caused the insulin production to go off the chart inside of her body, and she ended up being diabetic. How did she cure the diabetes? Certainly not with medication. She came off the medication she was taking and changed her diet. Now, that change in the diet resulted in her not having to take medication for diabetes anymore because she was no longer diabetic. If peradventure, we look at some of the conditions that people are experiencing today and the types of medication they were taking for one thing. So Pam mentioned, taking an aspirin for a heart condition, or people just taking plain painkillers like Tylenol or Motrin. Some of these actually do result in you having, a higher, as she said, a higher risk of bleeding. But then you find that this also does some damage to your stomach or your stomach walls. And so now you need to take another medication to ensure that the stomach walls are not adversely affected by the pain medication that you're taking. So now instead of one drug to treat one problem, you have two drugs to treat two problems. And you might end up having something going on with not just your stomach, but your entire gastrointestinal tract, which results in you taking an additional three, four medications. A lot of the things, like I said, go back to our diet. Some of the conditions that we have or have experienced over the years is because of how we eat. Now we have genetically modified foods, which severely impacts. We have water that is stored in plastic bottles that sit in the sun or inside of a container for days and weeks before it gets to the grocery store, before it gets to us, and we just pick up a bottle and drink it because it's what we call it's clean water, it's purified water. However, that
Mhm.
water has been sitting down for a couple of weeks or months in those plastic bottles. Are they safe? Probably not. Do we have options? Not very many. How do we fix some of these problems? Believe it goes back to our diet.
Mhm.
I believe a lot of the issues that we have go right back to our diet, how we eat, what we put inside our body, side of our bodies, how we regulate, and a lot of us don't actually exercise, or only exercise is going to work, walking from one office to the next, or going to the parking lot to get inside the car. That's the only exercise we get. So our bodies, don't actually function at optimal levels, because Pam should be able to help me with this. Your heart needs to function at a certain rate daily to put out a certain amount of blood to cause all your other organs to function. Sitting down limits the use of certain organs in our bodies, and as a result, we end up with conditions that people go, "Oh, yeah, that a pre-existing condition." How did it become pre-existing? My lifestyle.
True.
So we may want to look at how we eat, what we eat, what time of day we eat. Our food, Chad, is actually our medicine. Food has been proven to cure, not just manage, but cure many diseases. There have been many successes when we talk about cranberry and the potency of cranberry juice, the antioxidants, and the use of it in UTIs as a home remedy, or something that we use at home. We're talking about the soursop leaf, how the
Mm-hmm.
soursop leaf and drinking the soursop juice actually helps with someone who has been diagnosed with cancer. Green papaya, we use it in Jamaica. We grate it and we stuff it inside the cubitus ulcers, and it helps to heal the cancer, the ulcer from the inside out. These are not actually commercial grade medicines, but they work. They actually work.
Yeah.
So I'm just going to add there because, of course, all that you said there, Yolandi, is it is true. And we, again, I think it would have been so great to have had you on the last show with us because, of course, we talked a lot about, how lifestyle and lifestyle changes. We diet and exercise and all of those things which you mentioned, rightly so, that they do have a role. But we also need a balanced perspective when it comes because what you said was just really important. We're at a point right now in life where we cannot look the last 10 and 20 years, or even not even last 10 and 20 years. Maybe when we were growing up, we had cleaner air, cleaner food, all of those things, a different culture, how we prepared food. But where we are, you talked about GMO foods right now, where we're in this era where we're having to educate people and having them know, because if I can, from the lens that I sit in terms of the kinds of treatment that people are coming into the hospital because they're septic again, because they're staying home thinking that they can remedy something with a some home remedy, and by the time they get into the hospital, a lot of damage has been done. You have an organ damage and system organ damage because people delayed based on what they grew up on. And so as we think about the balanced perspective, how we treat and cure diseases, because it's here, we're not escaping it now because there is no much clean living, even though we owe ourselves a responsibility to be as healthy and as clean in our eating as we can. But you just said it, people probably the most exercise they get is from their desk to their car. And so
Mm-hmm.
there is some damage that is happening in that sitting, in that prolonged sitting 8 hours. It is happening. We can say get up because movement is good for you, meditation is good for you, exercise, a brisk walk, your cortisol levels are going to drop if you just walk around the block. But as we see, the microwave society, people are always constantly moving, and we know that is happening. We want to talk about prevention, but we also have to talk about cure because it is here. How do you cure it? And I want to just emphasize tonight that while home remedies are good, there has to be a place where we're talking about how do we cure that well. And I'm glad that you mentioned soursop because we had a patient who was there was a cancer diagnosis somewhere there, and delayed and says, I want to do the soursop thing because I hear that soursop is all the rage and we grew up on soursop and all of that thing. And I remember they called me in because, of course, the person is from Jamaica to have a conversation. And, I'm not going to say he or she, so we won't be gender. I want to be gender
Mhm.
neutral. So that person decided that they were not going to pursue treatment as soon enough. And I sat there and I said, "So, what are you going to do?" And that individual said they wanted to try soursop. And I said, "Well, as much as soursop probably would have cured cancer when we didn't even know what we were looking at, then what our grandparents didn't know it was good for them. They were taking these things, didn't even know what they were treating, didn't know that it was helping their bodies, but it was. Today, science tells us, and we marry all of those things. And again, a balanced perspective. Well, I guess within like maybe 5 months of him, her being on soursop because got the leaves from Jamaica and soursop heart and everything for about five. When they did the rescan, the tumor that was there was twice the size. If they had opted, and I don't know, like I said, we don't, we said that the last time, we don't always have a crystal ball to know where how things are going to work out. But as we marry faith, we marry science, we marry all of those things for a comprehensive, because this is what we have today. And we're saying, the Lord would have provided some experts in the field, because he knew that this is how life was going to be, kind of messy with how people are eating. You talk about radioactive things. Water is sitting there and people drink it because they don't have. Do they have more? Everyone can't buy organic, so they're buying foods that are, highly processed, pesticides and all of those things. They are getting into our bodies, and sometimes I don't necessarily think that it's going to be the natural remedies that's going to rid that. And do we end up with something else? Yes. You pick up your prescription from the pharmacy, and the side effects, the list is much longer than the one thing that you're trying to treat. But then we just have to weigh risk and benefits. If you're going to end up with some nausea, vomiting, and headache, to get rid of a tumor and end up on you're going to take tamoxifen, and tamoxifen is going to give you some GI upset, and it reduces the risk of cancer returning in the breast. It is that where we're balancing. How do we balance that? And not how do we balance that? We should find a way to figure out how to help persons to balance that, and not they're not going to steer clear of home remedies, but really understand that there are some potencies that exist in some of the medications that are really disease specific, and it is going to not only prevent, but in some places it could cure.
As you mentioned about these things, I was thinking while you were there, I was thinking, and because I have a personal experience about some of these things too, where medicine was introduced for something specific, and watching TV every day, and they tell you, all right, you're going to take a tablet, but this will give this, the side effect might be a heart attack or sudden death or so on. And I'm saying to myself, no, I have a pain in my left hand, and if I take this pill, I might have sudden death. Wouldn't I prefer to have the pain in my right hand or left hand rather than have sudden death as a side effect? So,
I'm sure that's how people weigh it, and that's why we say you're weighing the side effects. What are the risks and the benefits?
Because some of the side effects are far worse than the symptoms you're having to start with. What about some of these foods that we're eating today? All right, so let me kind of back up a little bit and then come forward to kind of give a perspective. There was a report out once about maybe some shooting or some accident or something, and they said 30 years ago and today the statistic were exactly the same. The only reason why it sounds so extravagant is because the information is now easily spread. Like, we have technology where there's an explosion, and within 3 seconds, the world knows about it. Okay? So we have the statistic of knowing things quick and easy. Could we use the same to say that people were dying of these same diseases and stroke and heart attack and diabetes, dementia, and all these back in the days when we did not have the technology to diagnose these diseases? So we didn't know what caused grandma to die or what caused grandpa to go into this kind of a delirious or whatever. Can we say that? Or now the diseases are more than they were 30, 40, 50 years ago?
Right. So I do believe, Chad, that the diseases or the spread of diseases that we're seeing today, of course, it is magnified. Populations have grown significantly since our great grandparents were alive. People are having more children. And again, the source of our food and water has significantly changed. And there are instances in scripture that speak to some of these illnesses that we're seeing today before us. They're documented in the Bible, and of course, we know that the Bible was written over 2,000 years ago. We have these accounts because they're reported by men who were actually privy to it in person and documented these things. We can take a look at Matthew 17:14-21. Where a father, and most people would know about this, the epileptic boy, where the father goes to Jesus and says to Jesus, well, my son, when this thing, he calls it a demon, when this demon comes upon him, he throws himself sometimes in the fire and he harms himself. And Jesus, in scripture, casts this demon out. This is actually epilepsy. Cerebral palsy is actually mentioned in scripture, where Jesus says that he healed the boy with the palsy. That's cerebral palsy right there. These have Jesus had an experience himself in the Garden of Gethsemane, where while he prayed, Luke's account of what happened to Jesus in the Garden of Gethsemane is that he started to sweat, and his sweat was like great drops of blood. That is an actual medical condition called hematidrosis. Jesus was actually having a medical emergency while he was praying. Luke is the person to give the account, because Luke, for the persons who don't know, the apostle, the disciple Luke, is actually a trained medical doctor. And so he was able to shed light on what was happening, the anxiety that Jesus was having about going to the cross and dying for all the sins of mankind. He had a medical emergency. So some of these conditions may have been around for a very, very long time, but the dominance of these or the documentation was not as great, because we didn't hear a lot about autism until maybe 20 years ago. All of a sudden, all these children, and we cannot negate the fact that this was not a very dominant condition amongst children, but we see larger numbers of them being born what seems normal, and then by the time they get to a year or 2 years old, they are regressing. We know about Down syndrome because, of course, it is something that is more easily identifiable, because it comes with definitive external features that you can diagnose quickly or readily. I don't want to call it dwarfism, but that's the medical term. Dwarfism. You can diagnose that from in utero, but autism you cannot. And we see a larger number of children having this condition, and doctors not necessarily being able to explain like the root of the problem, what caused it, how to even properly treat it. What we have been doing is managing autism, not treating it. ADHD, ADD. Where did these things manifest? Where did they come from? And why so many children have them?
Yeah, now that you mentioned ADD, ADHD, and so on, isn't that like kids throwing tantrum? Or is it really?
But it's not a medical condition.
But I'm from a whole different culture, so that's a different topic for a different day, because ADHD, it's not for me. I don't subscribe to ADHD.
Yeah, I'm trying to think. I have a friend who the kid just throw a few tantrum. Like, most of the kids I know growing up, they don't get what they want, they throw themselves to the ground. Okay? And they kick and they turn and they do what? Because that's what kids do. You know, foolish is in the heart of a child, but the rod of correction is there to drive it out. So the kid gets a little pissy every now and then because he does not get what he wants. And now the doctors want to load him up with pills. Now, remember, we talk about the side effects. So now these kids have now been suffering from the side effects of these pills that are supposed to what? Calm them down because they have a
Mhm.
little tantrum,
Mhm.
a
Mhm.
little thing that is supposed to be natural in human beings. No, we're adults, and sometimes we walk to the bus stop, we miss the bus, and we hit the door, or somebody say something about us, and we want to strangle that person to death. And the anger that builds up inside of us, we just turn around and, you know what I mean? Do we need pills for that? Do we need pills for that?
No, I'm in agreement with you on that. So, again, in our last conversation, I said, when you think about as a healthcare provider, we have an ethical responsibility to provide um, whatever treatment options are out there, not necessarily because it is my personal belief that I believe in it. It is my ethical responsibility. So you talk about ADHD. I'm from Jamaica. I didn't even, to be honest, I didn't even know that term until I came into America. So I remembered when the children who they were young as early as what a little bit out of kindergarten or first grade, they're like, oh, they're getting tested for ADHD, and I'm just having a real problem with that. I had an issue with that because I said, well, in Jamaica, every kid on our playground would have been tested for ADHD because we never sit still. We were
Yeah.
outside playing. And I realized I came to America and it is a diagnosis and it's a treatable diagnosis. So again, I have to put the disclaimer out there. My ethical responsibility says, if
Yes.
they present, I tell them that my personal feelings about that is it is a hard swallow for me to say that kids who are just moving, and how many times did we fall off a monkey bar and we were up and down, and every shoes we have, then we kick out the front, the back, the everything. In
Yep.
this culture, that would be, oh, they're jittery, they cannot manage their emotions, they can't manage themselves. And I'm like, who managed themselves at 8, 9, and 10? Had
At
any
3 years
real
old.
handle on sitting down and you sit still, crisscross, whatever, triple sauce for hours? I've
Yeah.
never really seen that. So that was hard for me. So it's one of those things. I don't subscribe to that.
Yeah. I find it, I might have to
And
have
I
a whole show on that, to be honest with you.
and I see, Yolandi wrote suicidal ideations, lethargy, and it is true. I think it is. You medicate the kids. I have my own personal feelings about this. So again, for those who are listening, as a healthcare provider, I understand my ethical responsibilities around how mental health providers treat children, how behavioral health is considered, and how it is assessed and addressed. However, I keep wondering ever since I learned about how ADHD and some of these other diagnoses in children are treated. You talk about the lethargy. Is it just that you want to keep them still all day? You just calm them because it's just too much work. You don't want to. Movement has to be a part of their activity, and maybe because we were in Jamaica, so we are outside all the time. I don't know how we would manage just sitting in the house and in the classroom. We had recess, we had break, and when break time come, we don't want to go back in, just like they do here in America. We played hide and go seek, and we don't want to be done when we play dandy shandy, and we're all over the place. Now
Yes.
they get to hear, and they're not out as much. And I feel like because they're inside, and maybe in Florida it's a little different. My perspective is here in Massachusetts where it is colder, like the kids are outside. I'm like, well, what are they supposed to do? Of course they're going to be jittery. So then you give them something and you medicate them so that they can sit and be calm. So it's less, you don't have to do much more. You don't have to watch them. You don't have to, like you said, the rod of correction was there for us. And I think we focused okay.
I, it worked. Yeah. Because so I'm wondering now with all the side effects of some of these pills now that they're giving, because remember, you see these advertised on TV, and the list of side effects are far worse than the very little simple thing you were having. And so now the side effects now in these kids at 3 years old, you are pounding them with pills. Then the side effect might be what? They start coming up and grow up and start doing some crazy things that we see are happening now. And then we wonder what happened, what got into these kids when they were kids, or what got into this individual that caused them to start doing some very strange and unseemly things. Can we check some of these medication?
Yeah, and medicine
Anyway,
won't accept that as, and I see that you, a 17 or 18-year-old is suicidal, but
mhm.
was on Ritalin when they were 7 and 8. But will they accept that that is probably part of the reason why at 17 we're manifesting with schizophrenia, we're manifesting with SI, we're manifesting with other behavioral and other psychological disorders. But what I find is that will they accept that that is probably the reason why, as they enter into the older teenage years and going over into even adults over 18, we're seeing some more mental health issues that I think was created from they were young when you started to medicate them with some of these things. But you know, the branch of medicine and behavioral health is yet to acknowledge, and they are not going to say that that's it. They'll continue to, and like I said, different conversation for a different night. So you brought it
Mhm.
up, and it's one of the places that I'm that's not my comfort zone, because I had a that they would have probably said ADHD too, but we had to be
Yes.
advocates for our children and say
Yeah.
absolutely not. I'm from a culture where no, let them run around, let them roam, and you won't
Let
medicate
them do
them.
things that kids do. They're gonna throw a tantrum. I've never gone anywhere like because I always say like we grew up with kids in church. We grew up with kids doing this because we're hauling the kids behind us. And I'm saying what you cannot expect. I am in church for 5 hours, let's say, or I'm in a sitting or a situation where I just sit still and be nice and that for 5 hours. Do I expect my 3 year old to do the same thing? No, they're kids. They're not going to do it. They're
Um,
going to roll on the ground. No. So how are
so
we expecting them to, because, they throw a tantrum, the next thing you know, oh my God, they're ADHD, AC, B, XYZ, and all that kind of foolishness. And then you go bring them to the doctor, and the doctor have a list of tablets. Because I'm telling you, I have a friend who that I said to the person, I would not subscribe with that to my child. No doctor is going to tell me to give pills to my kids because they think they're ADHD. No, they throw a tantrum. Yeah, we expect that to happen.
Chad, I believe that sociodemographics play a huge role in some of what we see transpiring amongst children and young people. Again, I go back to culture and what our belief systems are when it comes down to some of these diagnoses by medical professionals. As you said, in Jamaica or widely in the Caribbean, when a child throws a tantrum, they will typically give a tap on the hand or the butt cheek or wherever, and that child would calm down pretty quickly because they know that, such behaviors are not welcomed.
Mm-hmm.
However, and we see where in our culture, families go through different dynamics like changing through separation, whether it's divorce or common law unions breaking apart and a parent moving out of the home. The children are still in the home, they still have to deal with some of these things, but how they deal with it is very different. Our children are used to playing outside, going to the river, hanging out with friends. And because of these socio-demographics of this particular nation, most times parents work two, three jobs. They're hardly ever home because they always have to be on a job somewhere to try to ensure that ends are meeting. Many times the emotional and social needs of a child are not being met. And so as a result of that, even with them being in school, those social and emotional needs not being met will result in the some of the displays that we see, the behavioral issues that we find in some of the children, 3 years old, 5 years old, 7 years old, having to see a therapist because the parents separated, or because a child at school said something and the child is picking on them and they believe it's bullying and stuff like that. And don't get me wrong, some of these things in the schools are very, very, very real.
Yes.
However, because we have not also taught our children how to deal with conflict, or conflict resolution is not being taught in some of these classrooms, we find that they're not socially or emotionally or even developmentally prepared to deal with some of these things on their own. With absent parents, because of work or another reason, and they're not able to help the child, to have a discussion and to say how they feel about something. you know Most of these children are in therapy because the parent is not at home. They can't be at
Yeah.
home because being at home means that you're probably going to be homeless.
Yeah. Well, yeah.
You're going to lose
This
your
is,
car. And so we
yeah.
find that a lot of these issues are actually stemming from the unavailability of a parent to meet the social and emotional needs of a child. And Pam said maybe because she's in Massachusetts, the children are used to being in the house all the time. No, it's no different here in Florida. People work. And because they work, they don't see their kids. They spend, I'm not just being real. I'm
No,
two
but
jobs.
it doesn't snow a lot down in Florida.
It don't snow, but people work hard here because the cost of living in the state of Florida is rather high. It's almost the same as the state of Massachusetts, where we don't pay road taxes, but the food bill covers it. You see what I'm saying? We don't have to buy tires for the snow, but you certainly, most certainly, the distance from your home to your job could be 40 miles, 50 miles. You're going to need the same tires twice a year, or once every 2 years, the same way as you do in Massachusetts. So again, we may be living in different states or different communities, different demographics, but some of the issues that we face as parents or as adults in our communities are the very same. People are just not available to meet the social and emotional needs of their children because of the responsibility they have as a parent to clothe, to ensure you go to school, to cover your medical bills, and all that stuff. They spend a lot more time with their teachers than they do with us as their parents.
All right. So tell me now, Auntie Pam, with regards to, so this is how sometimes we do stereotype. We see a very heavy set person, and then just have to let people know that while we're taking care of our health, also there are some in the field we're taking as you as a health provider, and you have to, your job every day is to look out for the health for others, and you have to do that for the same. And we tend to see, say for instance, a heavyset person in the ice cream line. Is there anything wrong with that if the person is healthy, if the person is physically healthy? Because not all of us are the same size. There are millions of people out there, many different sizes, and it does not mean that because the person is heavyset, does it mean that they shouldn't have ice cream?
Absolutely not. I like how you frame that for us, the stereotype that goes with it. There's a stigma that is surrounded that if you are a certain build or a certain size, it means that you're unhealthy. So they equate BMI, body mass index, with health. Sometimes that is a relative measurement. It can be useful in some situations, but that's not always the case. It's very unfortunate that because some people are just genetically built that way. We have times when we'll say people are from a big bone family, my auntie big, so my cousin big, and if you look at our whole line that we come from, where that is how we are built. I usually use sometimes women of the Aztec women, tall and big. If we see them that is just really who they are. That is their genetics. And they could be the healthiest on planet Earth, but they are tall, big women. And
Mm-hmm.
so should they not have an ice cream? Absolutely, they should have an ice cream. And then there's also the myth that being skinny
I
and
was just gonna say
small
that. You
is
yeah.
going to equate to being healthy, and it is not. It could be very well the
Yeah,
opposite.
because I was just gonna say that a while ago that we see these people and we say, "Oh my God, we should throw that person a sandwich." And but sometimes also some of these people who are in these smaller body frames will make those who are heavy set as if they are not healthy. And isn't that kind of unhealthy for the brain also for people to be like that, especially sometimes in the workplace, sometimes at school or at church, all these areas. And now that I mentioned church, as I said earlier on, that when we talk, we use God for everything because I'm going to pray about, my health. I'm going to pray about not catching this, or I'm going to pray about getting well. So I want everybody to be mindful that we're Christians who believe in science and medicine. We're not the ones who don't think that you should not take your pill because it needs to get rid of so on. So what how do we approach that we be kind and not make people think that because I weigh 110 pounds, it means that I am more healthier than the person who weighs 260 pounds, and nothing is wrong with that person. Because as I said, we are looking at somebody who look like they need some cornmeal porridge, and then we're looking like somebody that does not need to be in an ice cream night. If you're healthy, you're healthy. Am I right?
If you're healthy, then you're healthy,
Mhm,
and it doesn't mean
mhm,
that you're a particular
mhm,
size just because you're healthy. Um, when we talk about health, one of the things that we do not discuss widely when it comes to health is mental health. That is a taboo subject in almost every area you can think of, in the church, in community, because where I come from, in particular, especially as Jamaicans, the minute you say the word mental health, that equates to you being mad.
Crazy. Yep, you're
that
nuts.
word that word equates to madness, and there's so many different aspects of mental health that has to be explored and discussed. There's good mental health, and then there's poor mental health. Some of it is invoked by medication, and some of it can be because of someone's emotional well-being or emotional state. We talk about schizophrenia, bipolar disorder. We're talking about personality disorders, borderline personality disorders. There are several aspects of we're talking about depression. You have clinical depression, different from just regular depression or severe clinical depression. So there are so many aspects. But what we do, I realize that many of us, as you made the comparison between somebody who is skinny and somebody who is what we see as overweight. There's a difference between someone being their natural size as opposed to obesity. These things are different for persons who their BMI. They talk about BMI. Let's discuss that. Let's go there. Because, I mean, your BMI is determined most times by your height and your current weight. But there's a difference between the Caucasian women and African women. There should be a different BMI scale for Mayan women, for Asian women, different parts of the continent, because of how we eat, because of our culture, because of our bloodline. Genetics also plays a role in how we look. Generally, after a certain age in my family, people just blossom. I won't say balloon, I'll say they blossom. Most
It
people,
is, yeah, it is true.
I'm saying, like seriously, Chad, a lot of people start out as very small in my family, short and small, and or even tall and small. But by the time they hit 38, 40 years old, they just blossom like a rose. Yeah, they
Yeah.
start to look real rosy. In Africa, if you are skinny, people think you sick. The bigger you are, first of all, they equate your body size with wealth. The bigger you are, the more money you have, because that means you're
mhm,
Yeah.
eating well. right?
Mhm.
Yeah.
Mhm.
and
Mhm.
and that does not mean that somebody is not healthy. We do
Hmm.
see where persons who are of a smaller frame having vitamin deficiencies, an actual medical condition that prevents them from gaining weight. We're talking
Mhm.
about thyroid functions here. When you go to your doctor and they tell you to do a TSH and an FSH, it is because they want to know what the function of your thyroid. People gain weight because of the thyroid going out of whack. It's not because of eating. And so, we have to be mindful, as you said, Chad, about how we judge others, the stigma that is associated with size. It doesn't mean that somebody is healthy. They could be very, very sick, being slim and trim, as we say in
Hmm.
Jamaica. And somebody else could be very, very healthy, what we call fat.
Hmm. Um,
Yeah, I see that she's preempting your mental health conversation, and I like it, right?
so and now that you mention it, because
Mhm.
we have that in line to go down to that segment. Now let's shift a little bit over, because as you mentioned about mental health and the word, I'm going to tell you something. If you talk about mixed race, the only two things come to people's mind are black and white. You say somebody's mixed, white man and a white woman, black woman, or the opposite. Mixed can be Chinese and Indian, can be Latino and white, blah blah blah. You name it. But the moment you talk about mental, you mention the word mental, people think you are gone cuckoo or bananas. Let's dive into people being in the church and the mental healthiness. Now we are Christians and we are supposed to be praising God. Are we supposed to have mental breakdown and have problems mentally? Are we, should I say, are we supposed to, or do we have?
Uh, um,
Pam, you want to go first?
so I'm careful with this topic because, of course, I said we were going to have a couple of mental health providers, experts
Mhm.
who
Yeah, would give us better.
this is
Yeah,
their area
yeah.
of expert. So I'll just skirt around. I'm just going to just really
Okay.
just
If we don't
skirt
want to
on the
dive
edge
deeply into
of
it, we can leave that for a next for another.
yes.
Yes.
No, but I will skirt just a little bit in terms again the fallacy around because we are saved or we're Christians that there is and when we talk about mental health, that Yolandi listed so many of them that there's a clinical diagnosis and in terms of um, and the mental health that I'm going to talk about a little bit as you talk about it would probably be mood dysregulation, right? Where mood dysregulation could be something like depression. And so people are saying you're a Christian, you shouldn't be depressed or you shouldn't have those moments where you're mood. So I'm not talking bipolar, I'm not talking schizophrenia, I'm not talking about those clinical things. I'm because it still falls under mental health, even then what we call simple depression. So I think he says, let's ask Elijah about that. There you go. That's right. It's I still do not understand why there is such a taboo in Christianity in the church when someone says, I am sad, I am tearful. Minister Yolande, she mentioned Elijah, but I was going to go to David, who sat and mourned and cried. Job, all of those that we have examples, so many examples of great warriors in the Bible who was broken, who was sad, who David says, why are you cast down, O my
Oh,
soul?
yeah. Oh,
Hope
thou.
thou in God. And so we're looking at in our day today, we would say he was very depressed. He was going through a phase of depression where he just couldn't bring himself. And so he had to pray himself. He had to sing. He had to encourage himself because he felt like maybe the Lord is not with me. Where are you? Job felt the same thing. As she said, Job wanted to die. It's just so. to me, I really have a hard time understanding, and I hear it a lot. Like if people say they're depressed or they're afraid to go into church, to say, I'm going through a rough time emotionally. And again, I'm leaving the mental component as the true clinical psychosis pieces of it, and just go into just the basic parts that still is part of the framework of mental health, where there's not that there's psychological safety in saying to somebody, I don't feel myself, I don't feel good. And someone says, well, it's because there's a demon, or how could you be saved, or it's because you're really not serving God. Well, it's just because you just really, how could you be a Christian, you really, your faith is weak, and all of those kinds of things. When we it's one of those things that we do have to confront as Christians in the church, that it has to stop. We really has to be, this is where we become our brother's keeper, because all of these examples that we're giving, they did occur in scriptures, and we're just really, like I said, just skirting around. If we went with all of the great men and women in the Bible and looked at their lives and whatever their calling was, how they got in whatever they were doing, there was a period when we could have attached a mental component to what they were going through, and who served God better than them, who was more connected to God better than them.
I have
Um,
a question. I have a before you go, Yolandi. I have a question from Instagram from Yardy Link. It says, with absentee parents in the household, is the school now responsible to foster and nurture, the social and emotional needs of a child?
I believe that that's the responsibility that a lot of parents have placed on the
In the
school
school. Mhm.
unintentionally, not by choice. We see that society does not allow for many parents to do what is absolutely necessary. Again, the cultures are very different. There are a lot of parents who have more time on their hands in Jamaica than a lot of parents here, and we parent very different from other cultures. However, I do see that where we have, the time that we actually spend at home with our children, we fail to actually make the necessary room, create the atmosphere for a holistic child rearing approach. Me and by that I mean we don't actually make time. A lot of parents don't actually make the time. I'm a parent. I have a child. I have a young child, actually. I have a 4-year-old who spends a little over 8 hours per day in daycare. When I go home, do I resort to just giving a bath, feeding the child, and putting the child to bed? No. We have social parent child bonding activities that we do for at least an hour every single day. Bath time. We're talking about whether the school gives homework, yes or no. And a lot of us as parents, I know as a Jamaican, I know this for a fact. The children get homework. Our response to it is, go do your homework. That's what we say. We do not sit with our children and ensure that what is being done or expected of them is done in an appropriate fashion. We don't use this as a time for bonding with our children. We say the teacher give you homework, and we say things like, I'm not the one who's going to school, you are. So you better do it and do it well. Meal times. We see the difference. Chad, you live in America. Meal times for most Americans is a bonding experience. It's not about just eating food. Taking the children out on a Saturday. We see men in America who dress up in little tutus to dance the ballet with their little girls, 3 years old and 4 years old. Would you get a Jamaican man doing that? Absolutely not. He's not dressing up in a skirt and tights. Definitely not. But
Okay.
these are ways that men in this country and other cultures bond with their children and create a healthy atmosphere for their children to be able to communicate with them, be themselves around them, and actually be the first person that they run to if something is wrong. We have in this time, in this era, we find that a lot of children are now going to the teacher, are not talking at all. They climb up, they go into a shell because who is safe, who is the best person to talk to, and they're not sure. You know what I mean? So until we start to create an atmosphere where our children are comfortable around us, where we make the times that we feel are an obligation or just something we do as a parent, a bonding experience, we're going to continue to see some of these problems with our children. They will find a safe space in other people instead of us.
All right. So we're going to have a show directly on addressing that. I was just wanting to put that in so that the person who's on Instagram didn't think we're ignoring because I just saw it. So back to our mental portion of the church now,
And the
Antipa,
biblical
because
aspect.
yeah, I I know for sure that, and I have experience. I have been going through for a few years, and everybody knows my situation as it relates to what I'm going through in terms of, the medical portion of my mother's situation. And there were times when I couldn't eat, and this is me. I couldn't eat food because I just couldn't move it around in my mouth. I had to drink Ensure because I was solely depressed. I was depressed, and I believe in God. Let me tell you, if it wasn't for faith, and I'm not talking about I just walking around and dropping word that, okay, yes, I have faith. I know that there's a God, and I pray every day. No, I am talking about a situation where I feel this particular connection of something different sent from above, faith, to know that yes, there is a God, and I need to hold on to this particular belief. And it takes me back to this wide perspective where not everybody is the same. And then how do we look at people if somebody says, I really feel depressed as a child of God and I need help? Do you encourage Christian people, because they're all different kind of mental stability and instability going on within young people, those who are older, those who are experiencing every different kind of experiences? How do we address that? Do we say to them, yes, you can get depressed, come talk to somebody at the church?
All right. So Chad, I want to go to the Bible in responding to this question, right? So we know that the word healing is mentioned in scripture, or health and stuff like that. It's in scripture, it's scriptural. So I want to do two definitions of healing, right? And deal with it from a contextual point of view. The Old Testament definition, or when it's translated, is from a Hebrew word called marpe, right? And it means health, cure, or sound of a sound mind. And in the New Testament, it's therapeuo, from where we get therapy, therapeutic. This is a Greek word, right? And it means to serve or restore health. Now, I said that it also means, of a sound mind, which means that someone can be of unsound mind. This is a biblical thing. When Jesus went onto the shores of the Gadarenes, he met a man that was bound in chains because he was uncontrollable. He had a mental health condition, or what the scripture describes as having a legion of demons possessing his body. This is Bible we're talking about, and you said it. We're all people of faith here, so let's really get into the nitty gritty of what truly happens to Christian people, right, or even believers. We do have persons who have mental health issues, or as Pam described it earlier, as what was the word they used, Pam, about the
Mood,
emotional state?
mood dysregulation or
Mood
dysregulation.
dysregulation, right?
Mhm.
We're talking about people like Moses. Frustration and anger caused Moses to strike the rock rather than speak to it when that was a command that he had from God. We see we're talking about people like Job, who said that I cursed the very day that I die. Why did my mother shut up her womb? This was Job going through what we would call depression. He was saying, I rather would have died than have lived this long and suffered this much. It is better if I passed away. She mentioned David. We can talk about Elijah and even Saul. He was
Mhm.
tormented. Saul suffered psychosis. So did Nebuchadnezzar. The man was eating grass like a donkey. Mental health conditions are real. and they do not have a certain class of people that they affect, whether you are saved or unsaved, whether you're a believer or you are an atheist. A mental health condition is not a respect of persons. Just like death, it comes for anybody at any time. The issue we are having as a body is that we believe, we perceive in our hearts as believers, and minister this from the pulpit, that if you have a mental health condition, then you're not only just possessed by demons, but that you lack faith. Yes, that you do not have faith, or you do not believe enough in God. When, listen to me, Jesus himself was having a mental health crisis because his anxiety caused him to sweat blood. Right? And should people in the church get a therapist? Absolutely. Especially people who
I
are
was I was gonna ask I was gonna ask that question too.
especially people who have been exposed to significant trauma, molestation, rape, abuse, whether it was verbal or physical or emotional or financial. People reduce abuse to you being punched or being beaten by somebody. People have suffered financial abuse, emotional abuse, and it does make them depressed. Even in the church, we have caused other people in the church to feel like they do not belong in the body of Christ. We not only point fingers, but what we have done is we have used scripture to pick apart at other believers and to cause a separation in the body of Christ. We call it a spirit of division. How that spirit entered in, you opened the door to it, you welcomed it, you set a table for it. The day you started judging the persons who entered the church as less than you because you believe that you are holier than them, we have a problem. We do have a problem in the body of Christ. We are traumatizing our brothers and sisters in the faith, and then having an expectation that after we traumatize them, we see someone going to cast out what we call demons out of them. Let us be real here. No, this is a conversation that we should have had a very long time ago. The
We,
trauma that we have, Chad,
it sounds like we need a whole show on this one.
we might,
No, that you
because
mentioned it, it sounds like that for real.
one of the things that what I'm seeing is that we superimpose offices and graces on congregations and demand something from them, some things that they cannot even give because they are not equipped intellectually or spiritually to
Oh,
give us what we are demanding.
hello. Hello. It sounds like you just have a contract with our show when it comes on to this. And are you sure you might not be stoned after you do this?
Listen, Stephen was stoned for standing up for the faith. I will readily be stoned, be cut in half, be boiled in hot oil, thrown in the fire. Whatever judgment is meted out to me for speaking the truth, as long as it is doctrinally and biblically sound, I will speak on it openly, boldly, and confidently, and without apology. We have a problem in the church.
So how, Auntie Pam, how do we solve, how do we work this out? Because to be honest with you, all of what Yolanda is saying here, it is true. I mean, if some of these people should be really honest, we would be surprised the things that come out of some of our fellow brethren. How do we what do we do now?
I know it sounds cliche when we are, because you're right, the points that, you know, very powerful, very true. It is really disappointing that the church, because the church are the people that the body doesn't recognize that they should be the first place that everyone we should be able to, or those who need that support should be able to come. It should be the first place. They shouldn't even have to go to a therapist, but we've gotten them there. That I'm in agreement that even the church people need some therapists, because a lot of damage has been done. So, because again, the church shirk their responsibilities in
Mhm.
terms of recognizing that they should be the place where people feel safe to say, I'm broken, I'm sad, without any judgment attached to it. Now, the question is, how do you fix it? And boy, it sounds like Yolanda is probably going to have the answer to this more than it's going to take much more than the conversation, because this is years of doing. It is not an easy undoing. You know what I mean? Because it has been so ingrained, as you see, and we even think about our young people coming in, right? The next generation who is supposed to be molded. They're
Mm-hmm.
walking into this environment that is set up like this, and so it perpetuates itself and it continues until we're like surrounded. It's like we are, people are just sinking, and you're figuring out, what am I clutching at? There is nothing to clutch at, and there has to be a fix, and the fix
Destroy
comes
the
from
faulty
all of us.
foundation.
Hmm?
We destroy the faulty foundations.
Yes.
But
Yes.
Yolandi, you touch on something, and I'm saying, like, for instance, you find a church that, give all these positions to many people who are not equipped. And you said that. And I've known many churches that do that. They give all these positions to these people who are not equipped to handle these things. Like, when you do evangelists and deacons and so on, these are people who are supposed to mentor, like, younger people, because what you want, as you say, teach a child the way they should grow, that when they get old, they should not depart from it. So when they are growing up now, you give people a whole lot of responsibility sometimes, that it's not that they don't want the responsibility, but they are not equipped for it yet. They themselves have to become strong to be able to stand up on their own 2 feet. And then now you pass on this responsibility to them. And when they're unable when they're to execute, now you turn on them and say that they need to be brought up to the front of the church and whisk these demons out of them. You know what I mean? So in their mind, because we're still on health and wellness and mental situation, and people tend to hold back a lot as it result that they're Christians, because it, like, men, I don't want to see people to see me crying because I'm tough, I'm strong. I'm not supposed to portray this kind of attribute. And I think too, it is the same for people who are in the church who are going through a lot of mental issues, that if they say I'm mentally tired or something, it's gonna show as if they're weak and they're not praying enough, or they're not Christians. So, but then again, you have, like, some of these wishy-washy elders, like, they don't know what day of the week it is, much more to encourage somebody who is not strong enough to, you know what I mean? Because remember, I don't know, I grew up and I know things have changed, and everybody will call me, I'm old-fashioned when it comes down to certain things. Elders in the church are people who are respected. These are people you should be able to say, I am not feeling a certain way and I need prayer. And these are people who say, let me call Sister Mary, Brother James, Brother John, and let us pray. And they will lay hands, because we believe in the laying of hands. That is something that we cannot get rid of. We're not getting rid of it. The laying of hands. And we reach out to heaven. And if this person needs counseling, but then again, as I'm talking about that, who do we have to counsel Christian people? Should we have, because sometimes we hear people, can an unsaved person counsel a saved person? Or is it because the person is a trained person in psychology, whether the person is a Christian or not, this person should be able to encourage or have therapy with a Christian person?
Right.
I need to just
So
interject
so
1 second and say something, and then I'm going to defer back to Yolanda, because she said something. So, in answer to that question, my preference would always be a Christian counselor if that's available. But you mentioned something, and I'm going to turf it back over to Yolanda, because I'm sure she'll expound on that with, you know, as it should be expounded on in the way it should be. And talked about those persons who are given a role or a position to be able to mentor or guide somebody else when they themselves are not fully developed, they themselves don't know really. But I wanted to say one of the things that she mentioned was the faulty foundation, that we still build on that. So elders come in under that faulty foundation, that nothing's changed. And I'm talking about a perpetuation of behavior. And there is something that is called a church culture, because churches can have culture. So they come in and this is what they know, this is what they see. So is there room to change or fix that foundation? Sometimes you just need to disrupt the whole thing and start building again. And so I feel like even with those people who are coming in, they're coming in and just picking up what's already there. They're not reinventing the wheel. They're just carrying on the mantle of whatever they picked up there. And like I said, I'm going to turf it over to Yolanda, but I feel like I just wanted to just add that to your observation as we talk about, you talk about people getting those roles and not being ready. But if you're in the same environment, the same protocols, the same policies, and nothing changes, you give me an elder role and give me that handbook. Unless we really get to that place where we're really ready, like she says, to confront some things, be an advocate from it, from the throne room, and says, because God has called me to this thing and it is the right thing to do. You may have a manual. That's not, I'm going to follow God's manual. I know that this is the right thing that I'm supposed to do. So that's what I'm going to do. And I think most people are just not brave enough or confident enough or courageous, or just doesn't, is not given the space to do it. And so that's why we see them falter so much in being a mentor or a leader when they should really stand up. Yolanda, it's your turn.
All right. So the first thing I want to do is talk about, I'm going to piggyback on that about the faulty foundations. Now, prior to Jesus coming, what was happening is that people were trusting in the letter of the law, right? Whatever was on paper was on the scrolls, and even Moses had to go back and then destroy the tablets because, of course, it never meant anything to the people because it was just words on a piece of stone, right? So then Jesus came. What I want to share, or what I want to expound on, is the fact that Jesus did not take men and said to them, I have called you, you are now a disciple, go out and do. He spent 3 years training, grooming, preparing, equipping those men to walk after him, to do exactly as he did, not just in performance, but in lifestyle. What they became were a reflection, they became a mirror image of himself, so that after he ascended, we would have that same Christ-like figure in the earth. Where we are having a difficulty in demonstrating this is because we are still on the faulty foundation of the old letter of the law, because men still continue to believe in just what the Old Testament. Jesus came and he gave us one commandment that covers every commandment. And for those people who don't know, we initially had 613. But because them did enough, Moses narrowed them down to 10. Right? Then Jesus came and said one thing: love thy neighbor as thyself. He said, without love, nothing else matters. If we're going to continue to purport or godliness or godman state or believer, whatever it is we want to call ourselves, right? Then we must become a mirror image of Jesus Christ. We must mirror his lifestyle in every aspect that he lived it in the earth. And what Jesus did was he never condemned. He used love to heal.
Yeah.
Literally and physically. Listen, the woman with the issue of blood was deemed unclean and should never, ever, ever be seen among people. She could be stoned to death. Jesus said that virtue left his body. Listen, the love that this man had, even the tassels on his talith, was able to heal a woman from an infirmity. It's not just the infirmity that kept her in the condition that she was. It was the condemnation, Chad, the condemnation that she suffered from the illness that she could have been healed already. But if those people did not continue to condemn her, right? So because of that condemnation, she was able to touch Jesus in a place where she could not touch another man. Amen. No, and I said amen. Sorry. I forgot I'm not in church.
Amen. Amen.
So now when we talk about Saul, right? We're talking about faulty foundations because we're getting to the root of the problem. Remember Saul, who was persecuting and killing Christians? A lot
Sorry.
of people believe that Saul was doing this because he hated Christians. Lo and behold, Saul was doing this because of his zeal for the Christianity that he was taught. The foundation that was laid for him when he was taught by Gaius in the temple. Paul was a philosopher. He was what we would call, he was a university graduate of his day and time. His parents had money. This man was born a Jew, but in Rome, and was taught by Roman intellectuals. And this foundation that was set for him, I want to say quickly before I go no further. Saul did not become Paul. Paul is actually his name. He has a Hebrew name and a Roman name. Is one person. His name never changed. And let me continue. Because of the foundation that was laid for him in the scrolls, in the temple, Paul now went out and persecuted Christians who were not aligning with the letter of the law that he was taught. But when he met Jesus, and Jesus taught him. So after his encounter where he became blind, now the blindness was intentional because Jesus wanted to show Paul that he was always walking in blindness, that he was never ever exposed to light. So he used his light, his love, to blind him, to show him the manner in which he was walking, and then opened his eyes. When his eyes were opened, he became a new creature, right? And he went away for 3 years. Now, the faulty foundation was utterly destroyed in that moment of blindness and his eyes being open. And for 3 years, the Lord set a new foundation, a new law before him. And he came after 3 years. And we see where Paul comes and he says to the people, listen, I did not learn this in a classroom. None of these scholars in the temple taught me. All that I have learned and I minister to you today, I learned from the Holy Spirit himself. Jesus taught me. And this doctrine that he taught me, I now teach you, because the doctrine I knew was faulty. Until we get rid of the faulty foundation, we will continue. Listen, Jesus tells us, Chad, that if you build it on a faulty foundation, the thing is going to crumble.
Yes.
And the church keeps crumbling. It keeps falling apart. It keeps breaking down because the foundation is faulty, was not properly set. So until we destroy that and build it completely from the ground up on the doctrine of Jesus Christ, we will continue to have these problems.
All right. So we're wrapping up now. What are we, and we're going to just keep it right here in the church for, let me see how best we can say, we can encourage our brothers and sisters, or our brethren in a broader term, how to get help if they need it. In wrapping up, I'll have Yolanda, give us your final word, and how do you tell people, whether young or old or middle-aged, live or spiritually dead, how to seek help if they need it, not because they're Christians, not to be proud, or because they speak in tongues, meaning that they should not ask for help. Yolanda, what do you think? And then Pam, I'll give you the last word.
Be purposeful about your faith. Your walk with Christ, be purposeful and intentional about it. If you're going to do it wholeheartedly. Don't do it in bits and pieces. You are not whole until you are completely healed. If you have trauma, whether it is from the church or from your childhood or from your community, ask for help. You may want to vet the person that you're going to ask for help and open up to as well. Not everyone can be trusted with sensitive information. And so you want to ensure that while you are praying for God to heal you and deliver you, everything that God does, he does through a man. He placed men in the earth to help each other. So while you are praying to God and asking for healing, be prepared for your healing to come through another man, right? Through someone who God has strategically equipped to deal with the condition or issue that you have. You may have to open up to this person and tell them exactly what is going on. Do not be afraid that when God leads you to someone, be open. If God has led you there, be open, be transparent, tell them whatever it is you need to tell them, and then God will ensure that the help that you need, you will get it. But do not continue to live your life and cover up the sickness, the condition with a fig leaf, with the belief that there's going to be a supernatural dispensation out of nowhere. You're going to just get up one day and that thing will not be there anymore. One of the things I've learned with healing is that forgiveness is an absolute necessity for you to be healed. So you might need to forgive a few people and then get the help that you need.
Sounds good. Pam?
Well, as we end tonight, it seems as if we're ending on mental health. The one thing I can say to anyone, especially when it comes to preserving your mental sanity and your mental space, is that's not a luxury. It is actually building capacity for your life. And especially as Christians, you're going to need that. And, the church is not a hospital, but one of the carriers that it could be is it should be an ambulance that gets you to help. So it should notice the suffering. It should respond to the suffering. It should stay present. And what I would say to anyone is that they should seek professional help without shame, not because you're a Christian. There should be no shame attached to if you need help. You should seek professional help and get it. And it is the church's responsibility, actually, to help you. Like I said, be the ambulance that gets you to that place. So,
Ladies and gentlemen, thank you for tuning in tonight to the Chad Pierce Show. As I said, we didn't even scratch the surface yet. Can you imagine? We didn't have enough time to scratch the surface, but we will continue this. As I said, we want to have meaningful conversation where we talk to people, we be open, we have people ask questions, we have these professional people who come in and speak with you. I want to thank Pam, who has been, let me tell you, more than a God-sent angel. I won't even get into that right now. Yolandi, thank you very much for the short notice that I gave to you, and you were prepared to be on the show. Thank you. And just so you know, if they don't stone you to death because of tonight appearance, then I'll have you back on the show again. Thank you for coming on. I appreciate both of you. And let's do this again. Thank you very much for everyone who's watching on TikTok, Facebook, and Instagram. We had some questions too that was on Instagram. I'm just going to have somebody monitoring that also so that we can get these questions out and these questions answered. What I'll try to do is sometime maybe just get them on a video. Somebody asks a question, we just ask one of these professionals to just say, Mary asked, how far is the sky from the earth? And Pam will say on a video, the sky is 2 miles, and we get it out. Thank you very much for watching. Have a great night, and we'll see you soon.
Thank you for having me. Thank you, Yolanda, for being a great co-host. Good night, everybody, and thanks for tuning in.
Pam, can you hear the music now?
I can. Oh, that's what the music was. All right, perfect. Wonderful. No matter where you are across the land, Chad Pierce.